Hello everyone, I'm Dr. Amit Kulkarni. I'm a Senior Consultant Lead Neurology and Stroke at Sakra World Hospital, Bangalore. What is revolutionary in stroke treatment and what has changed the stroke treatment over the last few years? So we all know that when somebody presents to us within this window period of 4.5 hours, we can give this IV clot-buster injection. And this injection is given through the intravenous route. And this is given for people who don't have contraindications and who have presented within this window period. However, whenever we give this clot-buster injection, only 30 to 50% of the people do open up the blocked arteries in the brain, which means still about 50 to 70% of the people are still left with blocked arteries and either persistent stroke symptoms or what we say as reocclusive stroke symptoms, where patient develops further neurological disability and patient may actually worsen. Hence, it's very important that even once we administer the clot-buster injection, we shift this patient to the cath lab and do what is called as a digital subtraction angiogram. Just like we do an angiogram to look at the blood vessels of the heart, we do an angiogram to look at the blood vessels of the brain. And we see if the blood vessel has opened up or it has not opened up. Generally, by dictum, when we look at an NIHSS or a stroke severity scale of more than 10, it means that it is likely to be a large vessel occlusion. By large vessel, I mean to say it may be an internal carotid artery, it may be the middle cerebral artery, it may be the anterior cerebral artery, it may be the basilar artery or the early part of the PCS. So if any of these arteries are blocked and after IV thrombolysis, the persistent block is noted, then what is done is via the groin puncture, a guide wire, a guiding catheter and a stent retriever is passed and the clot is manually engaged and the clot is extracted. And this technology, which is revolutionary, is called as stent retriever technology. So in this condition, we don't keep the stent there, but the clot is engaged, the clot is extracted from that area, which leads to opening up the blood vessels. And this has led to a remarkable improvement in the severity of stroke symptoms, not only immediate, but also the long term, hence reducing the disability, the morbidity, and the mortality of stroke. Thank you.